Myself, Dr. Sudhir Kumar Singh. I am residing at Dhanbad, Jharkhand. I have done my MBBS from Patna Medical College, Patna, and my MD from Patna Medical College, Patna University, Bihar. Today, discussion will be on hypertension. Usually, the patients ask, what is hypertension and how it occurs? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessel. This is called as blood pressure. Normally, in healthy persons, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle. For example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress, etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries can stiffen up and narrow as excess of fat builds up. Family history of high blood pressure. One or more close family members with hypertension increases person's risk of developing the condition. Excess salt intake also known to raise the blood pressure. Not in eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney diseases. Eating processed and fatty foods increase the fats throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, fat lack of physical activity is also linked to obesity and further to high blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious sign and symptoms. That is why it's often called as silent killer. It puts people at risk for several diseases, from cardiovascular problems to kidney failure, stroke, and even damage to the eyes and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether person have high blood pressure or not. Generally, when symptoms do occur, they include morning headaches, tiredness, vision changes, buzzing in ears, fatigue, nausea, or vomiting. If person is experiencing some of these symptoms, then one should get the blood pressure checked. It is usually measured with an instrument called as a sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let us try understand what do these numbers actually means. A healthy or normal blood pressure should be lower than 120/80 mm of Hg, or it can also read as 120/80 millimeter of Hg. Hence, the upper number indicates systolic blood pressure, which means pressure in the blood vessel when the heart contracts. whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when the heart rests between the beats. If blood pressure level is more than 140 by 90, then the person have hypertension. If person have BP levels higher than this, then he or she might be at risk of developing serious heart problems. This risk can be prevented and reduced by taking a step towards a healthier lifestyle, such as regular exercise, healthy diet, quit smoking and reducing alcohol intake, regular blood pressure monitoring, stress management, and adherence to medicines. If blood pressure is successfully controlled and with such lifestyle modifications, then it might avoid delay or reduce the need for medication. So let us take a look at these strategies one by one. First, regular exercise or physical activity. Exercise can be a drug-free approach to lowering high blood pressure. Regular physical activity makes person heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessels will be decreased and lowers the blood pressure. In another case, as we all are aware that age and weight gains are the two major risk factors for high blood pressure. So if the blood pressure is at a desirable level less than 120 by 80 milligram, then exercise can help prevent it from rising at your age. Regular exercises also helps you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most of the days of the week. High blood pressure level can be reduced by doing regular structured exercise such as brisk walking, jogging, cycling, and swimming. Second, healthy diet. Diet also plays important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through a dietary intervention, one can adopt such dietary pattern such as DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in diet. DASH stands for dietary approaches to stop hypertension diet. Eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dietary products and skimmed on saturated fat and cholesterol can lower one's blood pressure by up to 11 millimeter of Hg if having high blood pressure. Second, reduce sodium in the diet. Even a small reduction in the sodium in the diet can improve blood pressure, heart healthy by about 5 to 6 millimeter Hg. If you have high blood pressure, to decrease sodium in your diet, you can consider tips like read food labels. If possible, choose low sodium alternatives of the food and beverage you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods, but sodium is added during processing of the foods. So you can eat natural products. Don't add salt. Just a 1 level teaspoon of salt has 2300 milligram of sodium. Avoid adding salt to food. Use herbs or spices to add flavor to your food. Quit smoking. Most important. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart diseases and improve your overall health. Some of the hypertension patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure.